So we've seen a number of very, very interesting data already coming out in the meeting. I think these fall into a couple different categories. First, we've seen yesterday some data on KRAS G12C combinations. So we've seen both really impressive response rates, admittedly in small numbers, to KRAS plus SHP2 targeted therapy, the response rate hitting 75% in those patients treated at the highest dose levels. And that's quite a difference from our KRAS monotherapy dose responses seen more in the 30%. Looking forward to more confirmation of that in larger studies. We've also seen some other interesting data looking at low-dose KRAS inhibitor lead-in with Pembrolizumab therapy, and that is also something that's shown responses in patients who were previously treated with checkpoint inhibitor therapy and are now looking on to later line options. So I think more to come on both these combinations. Now, we've also seen some cautionary data looking at hepatotoxicity of the efzodarasib KRAS inhibitor when combined with checkpoint inhibitor therapy, either when given concurrently or when given potentially right after checkpoint inhibitor therapy. I think has some real implications when you're seeing a patient in clinic who might develop hepatotoxicity on therapy and requires interpretation relative to timing from last checkpoint inhibitor exposure. Later today, though not yet out, we'll see some other data looking at survival outcomes and some of our neoadjuvant and adjuvant immunotherapy strategies with the NADIM-2 and EMPOWER-010 overall survival data that I think is going on in the plenary just this morning. And then later today, we're going to see some data in small cell showing some active regimens using temozolomide plus PARP inhibition with a response rate nearing 40% in the relapsed refractory population, which is quite good for small cell, as well as some interesting early data looking at the BiTE DL3CD3 compound, which also seemed to have some activity, and that's an interesting immunotherapy strategy with some role it looks may have for small cell.